it's important to have conversations with your teenagers about sexual activity. And if that makes you uncomfortable, bring it up during your child's yearly well child exam. I am more than happy to help parents navigate those difficult conversations, but it's not something that a parent wants to be in the dark about
Right.
because in those situations, that's where we get those unwanted pregnancies.
Mhm.
That's where we get having to treat for sexually transmitted infections because those conversations are not being had. So that's really the most important thing is for parents to have those conversations with their kids and know that your child probably will not initiate that conversation with you. You got to be the one to do it.
Caring for others is part of your life, but it's not all of it. This is your space for growth, confidence, and connection to the whole you. Welcome to the DaliTalks podcast. Welcome back to the DaliTalks podcast. I have another amazing guest, as always. Dr. Kristen Cook is a pediatrician, and not only is she amazing, but she's going to be sharing so much information to empower you today. So, Dr. Cook, welcome. How are you?
Thank you. Please, you can feel free to call me Kristen.
Thanks.
Bye.
So, tell us a little bit about your background. Let's start with your childhood.
Sure. So I actually grew up in the western suburbs of Chicago, Illinois, and I always thought that I wanted to be an archaeologist.
Oh,
So
wow.
yeah, medicine wasn't something that kind of came on my radar until till later, really. And in fact, when I went to college at Marquette University, and I was studying to be a physical therapist. And then I started doing all the clinical rotations, and I realized I was more interested in what the doctors were doing.
Hmm.
And so that was a tough phone call to my parents because I actually was accepted into graduate school right out of high school, as long as I maintained certain criteria. And so telling my parents, I'm going to drop out of this grad program and I'm going to try to be a doctor.
Wait a minute, wait a minute. You
Yeah.
got accepted to a graduate program right from high school.
Yeah.
That
Yes.
is incredible. I don't think I've ever met somebody who who has been accepted. And yeah, I can imagine that phone call as a parent. You're like, what?
Yes. So, and then when I went to medical school, I went to Creighton University School of Medicine. I didn't know what kind of doctor I wanted to be, but my first year, I was telling everybody, I'm not being a pediatrician. Don't know what I want to do, but I'm not being a pediatrician. I don't want to wipe noses all day. And I have been very happily practicing pediatric medicine for almost 15 years.
Wow. Okay, I have to ask. Going from I'm not going to be a pediatrician, what happened? Is there a specific event or
There is,
experience
there
that?
is actually.
Mhm.
So I was doing my clinical rotations as a third year medical student in the children's hospital, and they were admitting a 9 to 10 month old baby that was having breathing problems. So this baby was breathing incredibly fast, working hard to breathe, not getting enough oxygen. And he was just sitting in this crib looking so helpless. And his parents looked terrified. And it's not like you could ask the baby, hey, what's going on? Why can't you breathe? And it really just intrigued me how pediatricians don't have the luxury sometimes of asking somebody what's going on. They have to figure it out for themselves. So, from an intellectual standpoint, that really just kind of very much interested me. And I've always loved kids. And then I think I just finally realized okay, it's not wiping noses all day. There's a lot that goes into being a pediatrician. And from that point on, I just never looked back.
Wow. Yeah. Okay, so let's dive into the nitty-gritty.
Yes.
We're talking about how so many parents are unaware about all the type of questions that they can ask their pediatricians because I think most of us just look at a doctor as this person where there are barriers. You don't talk about certain things with them because they're a doctor. So, can we dive into that
I would
aspect of?
love to. I would love to.
All right, let's go for it.
Okay. So, the first thing that I always tell my families is this is a partnership. You know your child best. I may know pediatric medicine best, but we need to collaborate and work together in order to provide your child with the best healthcare possible. And for the great majority of things, until a person is 18 years old, their parent is in charge of their care. So you bring your 11-year-old to see me for a healthy checkup. They can't say, no, thank you, I don't want that today. That's the parent's right, is they have a say in, again, the medical care that their child receives until that person is 18 years old. There are a couple of exceptions, and this is where it gets a little kind of gray in the area of that. Usually the biggest one that comes up in my practice revolves around sexually transmitted infections and contraceptives or birth control.
Mm-hmm.
Right out the gate, I always tell families, do your best to be honest with each other. Hey, teens, you got to tell your parents what you're doing. And parents, you got to be involved and initiate those difficult conversations with your kids.
Mm. Oh my gosh, that's so hard for both parties if
It
they don't
is.
come from
It is. But you know what? That's where you can loop in your pediatrician. And I've had plenty of times over the course of my career where a parent will pull me aside and say, Dr. Cook, I know my child is sexually active. I don't know what to do next. So, and I always encourage people to be comfortable. So, where this gets complex is that there are federal laws regarding certain types of healthcare services, and there are state laws. Now, the federal law will always supersede the state law, but every state is a little bit different in terms of mental health services, STI or sexually transmitted infection and contraceptive services, and substance abuse services. So the laws vary by state. So it's really important that as a parent, if you want to know what your rights are and what your child's rights are, you have to go through your state laws.
Okay, so as a parent who's never navigated this before, because when they're little, it's so much easier.
Oh yeah.
They turn, I think it's 13, and then now suddenly they can go into the pediatrician and ask for medical help or whatever without the parent, I believe. And I don't know if that's just state or
Yes,
federal.
it's state. So it's typically either 12, 14, or 16, depending on the state.
12, okay, wow. I didn't know it varied that much. Okay.
Mm-hmm. Yep, it can vary. But there's a misconception that when it comes to reproductive health issues, once a child turns 12, parents have no say. That's not the case. And again, there's subtle nuances between the state, but typically where that comes into play. So from a legal standpoint, most of the laws are related to the testing and treatment of sexually transmitted infections.
Mm.
To make things easier, most providers kind of lump contraception into that category. But again, it's slightly different based on the state. So I have had families over the years. So typically in the community where I practice medicine, the conversations that I'm having with the parents are, my kid is sexually active. I want to make sure that they are protected. How do we go about doing that? Where that comes into play is now I typically ask the teenager if they want their parent in the room or not.
Mm-hmm.
And the great majority of teens want their parents in the room.
Oh, that's good to know.
Yeah. And that, again, that's just my experience, but in the great majority of cases, the teenagers are like, yeah, I want mom here. Sometimes if it's a female, they might not want dad there, but they typically want mom there. And then so I initiate the conversation and I talk about the different kinds of birth control. I talk about what the purpose of each one is. And then I ask the teen if they have any questions. And I can probably tell you a handful of times where either a parent wanted the child to start birth control and the child didn't want to, or the child wanted birth control and the parent didn't want them. I can count maybe a handful of cases that's typically happened. Because usually if we have the right type of conversation, we can get everybody on the same page. So that's kind of how that works. Over the course of my career, I have never prescribed birth control that I can remember without the parent knowing. Because the other challenge is, okay, let's say you have a 14-year-old that is sexually active and wants birth control. They can't drive yet. So somebody has to go to the pharmacy and pick up that prescription, right? If it's birth control pill. If they want Nexplanon, which is a rod of hormones that the OBGYN puts in the upper arm,
Oh, yeah. Mhm.
they have to have somebody take them to that appointment, So there are some barriers, and not necessarily bad barriers, but there are some barriers of teens accessing this care completely on their own.
Mhm.
So,
Wow, that makes so much sense. And you know what? That brings me to a question.
yeah,
Are there any limitations of birth control methods for the younger ones? Because we
no,
no, all so every single type is available to them.
yes.
Okay.
I have had the youngest patient that I ever referred to OBGYN for Nexplanon was 11 years old.
Can we talk about like why they get prescribed that? Because I think everybody thinks it's for prevention of pregnancy, but it's not always the case.
Mhm. So, in fact, the great majority of the reason I prescribe birth control pills is for menstrual issues. So
Right.
I have had patients that have had such severe, heavy menstrual periods that they required blood transfusions. So
Wow.
that's typically the area that I see it the most. But I always ask, I say, what is the reason you want to start this? And fortunately, most teens are really honest because they realize that I'm there to help them. I'm there to, I'm not there to judge them by
Yeah.
any means. I mean, I'm here to help you. So I use a lot of birth control pills again for menstrual issues. I typically don't recommend birth control pills for the prevention of pregnancy because there are better methods out there. But
I
yes, there are young ladies that come into my clinic for Depo-Provera, which is a shot of hormones, simply because their periods are irregular, too heavy, they get super bad cramps that cause them to miss school. That is where the majority of the prescriptions that I do for contraceptives come in.
Okay. So what are other things that parents are not asking that they should?
Some things that they're not asking that they should. It's important to have conversations with your teenagers about sexual activity. And if that makes you uncomfortable, bring it up during your child's yearly well child exam. I am more than happy to help parents navigate those difficult conversations, but it's not something that a parent wants to be in the dark about
Right.
because in those situations, that's where we get those unwanted pregnancies.
Mhm.
That's where we get having to treat for sexually transmitted infections because those conversations are not being had. So that's really the most important thing is for parents to have those conversations with their kids and know that your child probably will not initiate that conversation with you. You got to be the one to do it.
Okay. All right. So what if I do want to ask you that question, but I don't want my child to know because if I ask it in front of you
Mhm.
during the appointment, they'll be embarrassed and then, we'll have that whole, oh my God, I can't believe you, you did that to me in front
Yeah.
of my.
Yeah.
Is there a way that a parent can reach out to you before the appointment? Because I feel like most offices have a big wall up where you cannot talk to the doctor unless you're in the appointment. And that can be frustrating because I might want to give you a heads up on something
Yeah.
before we get there.
Yeah. I have parents call all the time, and then the nurse just sends me a message.
Okay, so you just call the nurse and say, I just want to deliver this message before my
Yeah.
appointment.
And you don't even have to take the time because people are busy, right? Not everyone's got the time to call the doctor, wait on the phone to speak to someone. At the start of the appointment, as the medical assistant or nurse is getting you ready for that appointment, just say, hey, I want to talk to the doctor in private.
Okay,
Mm-hmm.
all right.
Yeah.
What about how do you deal with a parent who might be concerned about drug use? And do you happen to, because I'm sure you've seen the signs before a parent does, because
Mm-hmm.
sometimes we just don't know, especially those of us who have never used drugs. I have no
Sure.
idea.
Right. Yeah. So the laws regarding drug testing are very different. So A parent can actually request that a clinician order drug testing on their child without that child's consent.
Okay.
Mm-hmm. So if you are worried that your child is using marijuana, it doesn't matter. As long as they're under 18, you can call your doctor's office and say, hey, I want a drug test on my child. I don't have to get a yes from them. I don't have to let them know that this is what we're doing. Um, the parent can just request that. Now, from a communication standpoint, I always tell families it's really important that we loop your child in that this is what you want.
Mm-hmm.
And I have never had a patient, if a parent wanted a drug test, I say, hey, let's get your kid in the conversation. I've never had a kid tell me no. Not that it would matter, they would get the test anyway. But
Right.
I've, and I just feel like that creates more trusting relationships between parents and children.
Mm-hmm. Yeah. Yeah, but yeah, there might be those who are trying to hide it too. It's so something that I learned about is that sometimes doctors know what type of treatments or tests will be more costly to the parent, and the parent has no idea. Like my pediatrician, I remember I asked for a certain lab test, and she said, "Oh, that's gonna be very expensive because of what it was," and she suggested a different alternative. And
Mm-hmm.
she said, because you have, and I think at the time I had like Aetna or something. It's like, yeah, Aetna, they don't approve that. They're hard. And I was like, wow, I never thought to ask. And I
Mm-hmm.
was so surprised that she's like, wait a minute, before we do that. And I felt like she was really taking care of me that way because she must have seen what happens. And, today everything's so expensive with medicine. So
Mm-hmm.
can you talk a little bit about that and
Yeah.
maybe perhaps share like some of your challenges as a pediatrician trying to get some of those tests? Maybe there's some way that you and the parent can collaborate to help the insurance provider understand why something
Yeah.
is needed.
Yes. So one of the challenges of the healthcare system in the United States is a lack of transparency.
Yeah.
It's not like where you go to the grocery store where you know exactly how much a pound of bananas is going to cost. I'll be honest, as a healthcare provider, I typically don't have that information. It's very, very complex. It's a matter of the hospital administration and the insurance companies having their meetings and say, typically what happens is the healthcare organization will say, we charge XYZ for this service. And the insurance company says, okay, but we're going to only pay you this. So that's typically where the conflict comes in. And then the consumer is left with the remainder of the bill. So I typically don't know the cost of the services that I provide.
Okay.
Sometimes the computer system will let me know when it comes to medication. Sometimes the computer system will let me know, hey, this is not on their preferred level of medications, and therefore it's going to cost a lot more than an alternative. But I don't have numbers. So it's important. And the other complexity is that I have to make sure that what I am coding for and what I am billing for jive.
Right. Oh my God, that has been such a headache for me. And I learned I have VA benefits, so VA healthcare system, which
Mm-hmm.
is of course different than the civilian one. But the coding, how each institution handles it is so different. And I've learned that sometimes they have their own codes for certain things, which makes it hard to translate over to the insurance companies. Am I right
So
about that?
that I don't know about the military system. That is not the case for civilian healthcare insurance. The codes are standardized. It's called ICD-10,
Okay.
and that we have to follow. But
Hmm.
I had a parent the other day come in and say, Dr. Cook, we've got a really strong family history of cancer. Can we order genetic testing for my children? And I had to say, I'm really sorry, we can't because the insurance company doesn't do that. You have to have some type of symptom or something that will justify the insurance company paying for it. Otherwise, you're going to be paying out of pocket for what could potentially be very expensive tests.
Right. Ugh. And that's just so, it doesn't make sense because
Right.
it's supposed to be preventative medicine, not,
Correct.
yeah, reactive. But,
Correct.
reactive is what pays these insurance companies.
Unfortunately.
Yeah.
Unfortunately. Yep.
Okay. So is there a way that a parent can find out before you conduct the procedure or prescribe the medication, who would they go to? Because I know you wouldn't have the information as far as like how much that's going to cost.
Yeah.
So who should they be contacting in your office to find out the
The billing
cost?
department. The billing department should have that information.
And is that anybody at billing or is there specific people in there? Because
Oh gosh, they have their own departments.
Mhm.
I would just ask the pediatrician for the general billing number, and then they can help get you to the right person once they understand what you would like, what kind of information you need.
Okay, okay. And I know that's such a basic question, but I asked it because something like that happened to me a while back where I thought just call billing. And then
Mm.
billing had like some specific person to handle specific type of bills. Like for example, one that really sticks out is when you're asking for a reduction in the bill, a discount or anything like that, that is a separate person. And what I found out, because at the time I was going through Johns Hopkins, they have a third party person that handles that whole thing
Mhm.
outside of their facility. So that was just, it was a hot
Yeah,
mess.
it is. And the challenge is that every institution does it a little bit differently.
hmm Yeah, yeah.
Yeah.
Oh, okay. So what else? What else have you encountered that you think parents should know so that they can work better with their pediatricians?
Yep. When it comes to medical records, okay,
Okay.
a lot of healthcare companies now have electronic medical records,
hmm
which is fantastic. But some, because of these laws about sexually transmitted infection testing and treatment, mental health treatment, substance abuse treatment, a lot of these electronic medical records will turn off at a certain age.
Oh, you mean
In
like
our facility, they cut off as age 12.
what?
So yes. And
12.
again, it's because a child can request testing for sexually transmitted infections, and that is sensitive information. And those results I do not have to tell a parent.
Okay, so you mean the medical records is cut off to the parent.
Correct.
Okay, right. You still have
Correct.
access, but okay. Okay, okay. So that makes sense.
Yes. So
I'm
the
just
medical record is cut off and a lot of parents are surprised by this. A lot of parents will go on and say, Dr. Cook, I tried to get into the electronic medical records and I can't anymore. And I said, yes, it's because your child turned 12. Now,
okay.
our clinic, we have a process where if the child consents to the parent having access to that medical record, then the parent gets added back onto that account.
Now, is that a one-time thing or do they have to grant access every so
No,
often?
it's a
Okay,
one-time thing unless they tell somebody in our office, I don't want my parent to have access anymore.
got it. Okay, that's really good to know.
Mhm.
So then what happens once they turn 18? I know I'm cut off completely, but is
Mhm.
there a loophole? Is there something that my child has to do that's a little more official, put it in writing to say like my parents have access? Because I know they otherwise it's a HIPAA violation.
Yeah, unless there are extenuating circumstances. So if for whatever reason the child has a medical condition where they cannot provide their own basic needs,
Mhm.
then the parents can continue. Now there's legal paperwork that has to be filed to make that happen.
Okay,
So a
so
parent can become a guardian of their adult child, but that has to go through the legal system.
then that doesn't sound very simple when you say
It,
legal system. It's not like just sign this
it,
paper.
it right. It's not, but your pediatrician can, if you are one of those parents in that situation, a child that has severe developmental delays,
Mhm.
you can ask your pediatrician for guidance on how to make that happen.
Yeah, and I'm pretty sure you kind of like lead up to that before they turn 18 because you know that
Yes.
you're gonna need it. Okay,
Yes.
that's
I usually start those conversations when a child is 16 years old
okay. Yeah. All right.
because it takes time to get those documents in place.
Mm-hmm.
So that's again 16, and that's not standard of care. That's just how I practice.
Right. Okay. And I love that. I love that because you're giving parents enough time in case there's like legal things that, how everything legal can take a very
For-
long time. Not just legal, but just like paperwork. Like
Mhm.
institutions just lose things, or sometimes they update forms. You have to refill out something, and it's frustrating.
Yes.
What about, oh, this is something you told me offline that I was so excited about because I had no idea that you can keep your minor child with your pediatrician after they turn 18. Can you talk a little bit about that?
So every pediatrician is a little bit different.
Mm-hmm.
I start having the conversation of it would be in your best interest to start looking for a grown-up doctor around 17, 18 years old. Legally, from and not legally, but in terms of my malpractice insurance, I can see people up until the age of 21.
Okay.
So yeah, I mean, just this week I saw a 19-year-old.
Mm-hmm.
Um, Now, whether that is in the best interest of the person, because as you get older, there are grown up problems that start happening that I may not know how to treat.
Okay.
But a good physician will be very honest with you about those kind of cutoffs. And
Okay.
every pediatrician is a little bit different. I know I have some colleagues that if you get pregnant and have a baby, you're no longer allowed to see the pediatrician, even if that person is 14 when they have a baby.
Yeah, because they'd
So,
have to go to an OB, right?
yeah.
Yeah. Mm-hmm.
So it's important to talk to your healthcare providers about that.
Right. Speaking of OBs
Mhm,
and gynecologists and stuff like that, for minor children
mhm,
who may be pregnant,
mhm.
they would still go to the OB, but still always maintain their pediatrician, right? Okay.
Yes.
All
Mhm.
right. And does the pediatrician and OB have communication?
Oh, yeah. Mhm.
Okay, because I know that not all have communication going on, and that can be frustrating. All right.
Yeah. At least in my institution, we have excellent communication with the OBGYNs.
So then if you have a patient who's going to an OBGYN outside of your clinic,
Mhm.
do you have easy access to the records, or is this something that parents need to do to provide to make sure that you have access to those records?
So it depends on the institution.
Okay.
So the company that I work for, the pediatricians and the OBGYNs are in the same medical group. So we have the same electronic healthcare system. If you are in a community where you have an independent pediatric group and you will be going someplace else for OBGYN care, yes, then it is on the parents to say, I want to share information. How do we make that happen? And it's typically very easy. It's just a matter of signing a release of information.
Okay. All right.
Mhm.
And now that everything's electronic, that should be easier for you to also access everything like scans and
Mhm.
whatever else. Okay. All
Mhm.
right.
Yep.
Okay, this is good. What else should parents be asking?
What else should parents be asking? Mental health is a big one. Unfortunately, we are in a mental health care crisis in the United States. We do not have enough psychiatric providers, counselors to meet the demand. And I, as a pediatrician, did not receive a lot of training in the treatment of mental health disorders. And I want to help my patients, but my knowledge is limited in that field. And I've had patients come in and say, my child has anxiety. We've been seeing a counselor for years. The counselor recommended this medication. And they get a little surprised when I say, I'm really sorry, I'm not comfortable enough with that medication to prescribe it to your child. But if there's a medication that I'm not comfortable with, I'm not going to prescribe it because I don't know how to manage it.
Yeah.
Um, and it's important to look for the signs and symptoms of a mental health disorder. It doesn't necessarily present the same way as it does in adults. Sometimes you're not going to kid that tells you, Mom, I'm really anxious all the time. Sometimes it shows up as I have daily headaches. I have daily stomach aches. I'm not sleeping well. My appetite is changing. And mental health disorders are not limited to teenagers. I've treated kids as young as 4 with medication for anxiety.
Mhm. Wow.
It so it we live in such a complex world, and because of social media, like there's no privacy anymore. It's important for parents to be on the lookout for that and
Yeah,
really advocate for your child. And if you have a provider that is dismissing any of your concerns, you need to find a new one.
I agree. I agree. And you know what? I'm going to be honest about the mental health part. And sometimes not just the mental health part, but like I have been in situations where I'm concerned that if I share that I'm going through, say, something stressful in my life, then the diagnosis is going to be, oh, but you're just stressed. Because especially for women, because that happens to us so much. And for my younger girls, like for example, heavy periods. And I have 2 girls. And the first thing that they say is that I always hear is it's always birth control to help with the periods. And I always think, why is it that? Is there no other solution at all? Is there a holistic one, something that's actually effective? Or is it just because that's what the standard practice is? And it's not just about the birth control, but sometimes like the stress, like I mentioned. Um, so how can we, as the patient, make sure that we help you not go there? Because I think sometimes unconsciously we do it, not wanting to do stuff like that. But
Mhm.
how can we help our doctors make sure that they're not taking it too serious just because I said, oh, I'm going through all of this. And so now the doctor might think, well, it's a stress.
Yeah. I've never thought that in my entire career. And I don't know a lot of physicians that actually do. So I think parents can be, you will know if a healthcare provider is being dismissive to you. And again, if they are, you need to find a new one.
Yeah.
In terms of the birth control for periods, unfortunately, that is the only method, with
Mhm.
one exception. The exception is if the menstrual problem is only heavy cramps. If the child has a regular menstrual period and knows when they're going to get it, you can start around the clock ibuprofen to about 3 days before the period starts. Ibuprofen contains an ingredient that blocks the production of something called prostaglandins, which
Mhm.
are the chemical messengers responsible for cramp. So, for menstrual cramps, if the periods are regular, I will sometimes use that ibuprofen approach, especially if it's a family that is not interested in any type of contraceptive.
Okay. All right. Thank you for answering that one. I know that can be a little weird, but I asked it because that has happened to me and not by women. It's always men, sadly, which yeah, probably doesn't surprise you. I think they just don't get
Yeah,
it. They're
no,
like,
no, and that's a whole other
yeah,
episode.
right. Let's see, what else should we be asking our pediatricians?
I think one of the barriers, I sometimes parents are embarrassed, and don't be embarrassed. We've heard it all.
Hmm.
If you have concerns that your child is masturbating too much, or if you have concerns that they don't have good hygiene, it's okay to bring it up. If you have a good relationship with your pediatrician, that their office is a safe place to talk about any of that stuff.
Hmm. Yeah. Yeah, I think I got lucky because well, first of all, my kids have been with the same doctor since they were born.
Mhm.
So it's almost like they're almost like a family member, like like not
Yeah.
a direct family member, but like
Mhm.
she knows the birthdays and she remembers when she lost her tooth and all of this stuff, which is pretty cool.
Yeah.
So for us, we do feel comfortable asking a lot of questions because we've known her for so long. But then I know that there are families that move around a lot. They have to switch out doctors all the time. Well, do you have anything else that you'd like to let us know
Oh,
that we should be asking?
gosh. Know your medical clinic's policy on who can obtain medical records.
Okay.
Oh, I know. This is a really important topic that oftentimes does not come up.
Okay.
Okay? And this relates to married versus unmarried parents.
Oh, okay.
So if the parents are married, either parent can consent to medical procedures, treatment, medications, those kinds of things. If the parents are divorced or are no longer in a romantic relationship together, both parents have to consent to the treatment. Now,
Huh.
where I
Okay.
see this come up the most is in the management of attention deficit hyperactivity disorder as well as mental health disorders. It is not uncommon for one parent to want to pursue medication and the other to be very, very against it.
Oh,
In that situation, I have to say, you guys need to come to an agreement or I can't do anything.
mm-hmm. Oh, that's sticky. Yeah.
It is, it's
Yeah.
very sticky. And the challenge is, I don't necessarily know unless people tell me, I don't know if you're married or not.
Right.
Because I can't rely on the last name because some people don't take their partner's name when they get married,
Right. Mm-hmm.
you know? So that gets a little sticky on both sides of the equation.
So how do you as a doctor ensure that you don't violate that part of the
So fortunately, I have been at the same clinic my entire career. And now one of the things that's so exciting is my former patients have grown up, are having babies of their own and choosing me to be their child pediatrician, which is
Oh.
amazing. So I know my families well, but in those situations, I have to ask the uncomfortable question, are you legally married? Who
Mhm.
who gets to make the medical decisions for your child? Because in the cases of divorce, maybe
Yep.
maybe legally only one parent is allowed to make those decisions.
Right, right.
And so then I have to have those difficult conversations to make sure that I am doing what's in the best interest of the child, or not in the best interest of the child, but what legally I'm required to do
Mhm.
before any of that.
Yeah, okay. I remember my question now. It was regarding IEPs.
Yeah.
Can you tell us a little bit about how far into the IEP diagnosis you get involved?
Yes. So IEPs and 504s are two different things. And again, that's a whole nother conversation for a different day. But 504 and IEPs, or individualized education plans, are accommodations that schools make for students with disabilities. Now, I don't like the term disabilities. Those laws were enacted in the 1970s, so they use the term disability. Disability has such a negative connotation. A child that has diabetes is considered to have a disability. A child that has ADHD is considered to have a disability. So it's not limited to like learning disorders and
Mhm.
physical conditions. Parents need to understand that a lot of different medical diagnoses will qualify you for a 504 plan. It's a lot easier to get a 504 plan than it is to get an IEP. Um, it also gets a little tricky because if a school receives funding from the government, that child is automatically entitled to a 504 or an IEP if they have a qualifying medical condition. If the child is in a private school that is privately funded, the schools don't have to make those accommodations.
Oh, wow. Mhm.
And the accommodations are going to vary greatly depending on the diagnosis. And so the pediatrician comes in actually typically very early on in the process, because unless it's a learning disorder or a school problem, you need a diagnosis first before you can pursue a 504 or an IEP.
Right.
And I have plenty of families in my medical practice that want their child evaluated for ADHD, not because they want to start medication, but simply because they want to try to get an IEP. And
Okay.
so again, the pediatrician comes in very early on.
All right. Yeah, that can be. And then that's just what does that look like? Is that just a letter from you to the school saying this child has been diagnosed with this
Yeah.
and you
So
recommend it?
yeah, in it depends on what the school needs in the majority of cases. So we give all of our patients something called an after visit summary, which is a printout of a summary of the visit.
Mm-hmm.
And typically, if the diagnosis is on the after visit summary, that's all that a parent needs to give the school.
Oh, that's good. Very
Yeah,
simple. Mm-hmm.
right. Because, you don't necessarily have to give the school all of everything. You don't need to hand them your child's medical records. Quite honestly, that's none of their business.
Mm-hmm.
So yeah, that's typically all that's needed.
Right, right. Okay, wow. So much. This is really good.
Good.
And I'm trying to think of like what else should I be asking, but I'm pretty sure later I'll think of more things. But these are the main questions I wanted to ask right now because to me, with speaking with parents,
Mhm.
those are the ones that come up all the time, very, very often. So I just want to thank you for sharing and being so open about your
Totally.
practice and it sounds also like really tough for doctors and I'm not sure how all of that's going to change with so many things changing in medical in Medicare or medical in the medical industry right now and funding and all that. So hopefully your job won't be any harder to provide families with the medical attention that they need.
I hope we have a lot of Medicaid patients in our practice and my heart goes out to them. And I hope people realize that these services are essential
Mhm.
and it's going to backfire to try to make the degree of cuts that are supposed to be coming out.
Yeah. Yeah, it's scary because I know a lot of people that have a lot of conditions that really depend on those needs. And then I also think about kids with the IEPs and stuff like you were just saying, public schools will do this, but the private ones won't. And I'm like, oh my gosh, all that
Yeah,
funding. And
and not every private school won't, but they aren't legally mandated to.
right, right. And one last question, just so that parents understand what you have to go through in order to make sure that you provide care for them efficiently, but also are always like following the law because things change all the time. How often are you trained by whoever it is that trains you on like to keep you up to date with laws? How does that happen?
Never. It's on the physician to find out for themselves.
What? Oh my gosh. That is a lot because there's so much every day. Wow.
That's
I'm
on the
sorry.
physician.
I thought you had like monthly trainings, like, hey, this is the
No,
update for, oh my gosh.
no, there's no. I
Wow.
mean, you probably could find a continuing medical education course on that topic, but again, the physician has to be the one to initiate that process.
Wow. I'm so sorry. I was so sure you all had like monthly or quarterly at least updates by
No, no,
HR or somebody out there.
no, we don't. We're kind of out there on our own, but that's okay. What we
Okay.
do have, though, in my institution, and I'm sure a lot of institutions do, is they have coding reviews. So quarterly coding reviews to make sure that the physicians are coding diagnoses correctly and billing correctly. And in our institution, if you don't have a 90%, like, yes, you're doing good, then you have to meet with a coder to discuss how you need to change your practice.
Mhm. Oh, wow. Okay. Wow. Well, thank you so much,
Hey,
Dr. Cook, for all of the knowledge that you just shared. Do you have any last suggestions or anything that parents should know?
nobody parents perfectly. It's okay to make
So true.
mistakes. And again, your pediatrician is a great resource, not necessarily just for medical information, but for information about 504 plans or IEPs. And there's no stupid question. Don't hesitate to ask your pediatrician.
Thank you so much, Dr. Cook.
Thank you. It was wonderful to be here.
Thanks.
Thank you.
Okay, you know what blew me away about that conversation was that last part where Dr. Cook said that she does not get trained on the coding part. Actually, I think she said this offline after she said goodbye to you guys, but she expressed that, or she explained that during medical school, they're not really taught about the coding part and they're not really taught a lot on like the pharmaceuticals part, because, you know, they are prescribing medicines, but they also have to make sure that the medicine that they're prescribing does not counteract from other medicines that might be going on. So they have to be very careful. And then also the laws part, like she was saying, nobody's there to train them. So they're expected, she said, to provide good health care and not break the law, but nobody's training them to update them on what's changing in the law and all of that stuff. And that's just crazy. Anyway, I really hope that you enjoyed that podcast. All right. If you like this episode, don't forget to share it, and please leave a review wherever you're listening. And I'll see you next time. Hey, did you like that episode? I have an ask. Would you mind leaving me a review? It would really help me improve this podcast so that you can come back and keep listening. Also, don't forget to check me out at DaliTalks.com and follow me on social media at DaliTalks. Until next time.